Hi, Mark and Brian here, Fitness4Life PT.
And we're not telling you which one is which today, so you can figure it out. But we've been told that we need to do what?
We got to give the people what they want.
Okay, so we're going to try to do that. We're going to talk total hip replacements. Now, total hip replacement, the good news about a hip replacement is that is the surgery that they know the most about. Typically, it can be the easiest recovery over knees and shoulders. But you have to know what to do. You have to respect what the surgeon tells you. A lot of times there's precautions, okay, that you have to follow too, just to make sure you're safe. But total hip replacements have excellent outcomes. People are able to return to activities and that after them. So we're going to talk about them. Two approaches that they use, what they call an anterior approach, where they were going from the front, or a posterior approach, where they go in more from the back, so right through here. All right, the differences being with the posterior approach, and that is one that is usually most common, although a lot of surgeons now are going to the anterior approach. But the differences are, with a posterior approach, they're cutting to some of the muscles back here and they have to reattach them. And after your surgery, you've typically got precautions for 6 to 12 weeks after, depending on what your surgeon says about that. So you always want to check with them. But the precautions are, after a posterior approach, are you can't flex your knee past 90 or your hip past 90, which means you need to elevate your sitting position usually. You have to be careful trying to put on shoes and socks. The second precaution is you don't cross your leg over the midline, so coming in. And the third precaution is you don't rotate your hip inward like this, because with that posterior approach, that will put stress on where they went in at, and in instances that can cause that to come out. Now, for an anterior approach, they go in the front. With the anterior approach, they don't have to cut muscles. They separate the muscles to get to the joint. Now, it's a little bit more difficult from what the surgeons have said because they don't have as clear a view through the anterior, but they do great jobs with this surgery. Anterior approach is especially good for more active people because you don't have those hip precautions for the 6 to 12 weeks. Your basic hip precautions with an anterior approach is that you don't want to extend through your hip too far, so bringing your leg back so you wouldn't be doing stretches that direction, or turning your foot out, so what they call externally rotating. Those would be your precautions for an anterior approach, typically 6 to 12 weeks. Okay, so surgeon is going to decide which approach is best for you, but those are the options. Now, things that people need to realize, and after this, one of the things is putting your pants on. So what is easier is if you support yourself, hold your pants, put your surgical legs through the pants leg first, pull it up, and then again, always keeping yourself supported and safe, then put it through the other leg. Taking it off, surgical leg first, let it slide down. But those are usually, that's the easier way to do it, so you're not trying to putting it on your good leg and then trying to have to bend your leg up to get it on. Okay, so that is getting dressed. Now, with gait, so walking, a lot of people forget that they need an arm swing. So when you're walking is good for this, but again, depending on what your surgeon said, a lot of times you may start off with a walker and then move to a cane. But as you get off of those assisted devices, you want to make sure you have a nice shoulder swing when you walk. Don't walk with your arms planted at your side, because that helps mobilize the joints and helps everything work a little bit better. But again, you're not, especially for the first 6 to 12 weeks, with the anterior approach, you're not going to overextend that back leg. So a little bit slower, a little bit shorter strides starting off, okay? So, the other thing is that Now this is according to research from 2018, so this is the most recent research that I found. People want to know, when can I go back to activities like their normal stuff that they were doing before? 65% of the surgeons in 2018 said anywhere from 3 to 6 months is when they allow their patients to go back. Now again, saying that meant 35% of them did not agree with that. So as always, and I cannot caution you enough with this, you're going to check with your particular surgeon because they are going to tell you when they think. But typical activities that the 65% said: back to walking, back to weight training, low impact aerobic classes, cycling, okay, doubles tennis. What else did they have on here? So swimming, going back to hiking, cycling on the road or a stationary bike, weight machines, stair climbers, ellipticals. But those are some of the more common activities people want to return to. So after 3 to 6 months, it's usually safe to go back to those. Things that you're not going to be doing anymore: singles tennis and martial arts. That's at least what the majority of surgeons say you should not return to. So, some helpful hints hopefully for you if you're thinking about total hip. If you have further questions, contact us at Fitness4Life Physical Therapy.com.